Welcome to the Medical Manners Podcast, where I give healthcare providers simple tips for ways they can transform the way they connect with their patients and colleagues. Connecting with patients isn't some secret sauce that some of us have and others don't. They're just skills, implemented consistently over time. If you want to transform your medical practice, you're in the right place. I am Katie Wyatt, your host. This podcast episode is sponsored by the Connect Better course. This is an audio course for medical providers who want to transform the way they connect with their patients. If you're an individual provider or you have a team of providers who is hoping to improve your patient satisfaction scores, improve your job satisfaction, and boost the prosperity of your practice, this course is for you. It's a 6-week course with an area of focus each week that will teach you specific skills, phrases, actions, and formulas to change the way you connect with your patients. Visit medicalmanners.com and use the promo code PODCAST for 10% off this course. Today on the podcast, I have Dan and Michele Deceuster. Dan was diagnosed with testicular cancer in 2020, and he and his wife, Michele, were gracious enough to talk to me about their experiences. These guys really were good sports. I thought I had hit the record button when we started talking, and I realized at the end of the interview that I had not. And they were gracious enough to do the entire thing over again, and I am so grateful. I have thought about the Deceusters often since and what Dan taught me about changing the way I ask patients if they have any questions for me. And I'm so excited for you to learn from them too. So Dan, tell us about your medical history.
Absolutely. In December of 2020, I was diagnosed with testicular cancer. This was during COVID, obviously in 2020. So they made me do a test before surgery, and I tested positive for COVID as well. So I was diagnosed with cancer and COVID on the same day. And then 2 days later had my orchiectomy on my 38th birthday. 2 months after that, the scans after that showed that slightly enlarged lymph nodes. So it was like, maybe it had spread, maybe not, maybe we got it out. So we waited 6 weeks and rescanned and yeah, it had spread. So we knew we needed to do the chemo. So did that from February through May of 2021. And then took 2-3 months till my hair started to come back and get energy again and kind of feel like myself. So all in all, it was probably about a 9 to 10 month ordeal going through a cancer diagnosis and treatment.
Perfect. And like we were talking about before we started the recording, I hadn't realized for you guys that COVID and your cancer journey was at the same time. And that's kind of a wild ride. So tell us, as you were in and out of facilities over the course of your 9-month journey, what are things that healthcare providers said to you that were especially meaningful?
The first thing for me was from the urologist that delivered the diagnosis. So I first saw my general doctor for physical, who got me into for an ultrasound, and then they sent the results to a urologist, and that's when I received the diagnosis. And he said, "This is cancer," but immediately said, "And you are going to live." And he said, "This is a testicular cancer, is very highly curable, very high survival rate." And he even said, if I could choose a cancer, if I had to get cancer and choose a cancer, this is the one I would choose. It's the most curable. And so it was very reassuring before explaining that it is in fact a deadly cancer. If untreated, I would die within a year. Didn't get into that nitty-gritty until after he had made it very clear that I will live, which it was a 95 or 96%.
Yeah,
it's very, very high. So
which honestly, that was really comforting to both of us.
Yes.
So that, it's really helpful to just be like, okay, he's going to live, he's going to be fine.
Yeah. I train healthcare providers on how to connect with patients. And one of the things I really focus on is spreading happiness into the lives of our patients. But there are certain medical professions where it's really tough. You're in a spot where you're giving bad news all day long. And so in those instances, I train healthcare providers to spread encouragement. And so I love that your doctor was very encouraging in a really tough time for you, but started out immediately with encouragement. So I love that. Let's give a shout out to your urologist. Who was that?
That was Dr. Whiting at Intermountain Healthcare here in St. George.
Good job, Dr. Whiting. Let's go to the next question. And that is, what did healthcare providers do for you along your journey that was meaningful?
My very first day in chemotherapy, I specifically remember there was a very elderly gentleman in there that within an hour of sitting down was heaving, and he was very apologetic to everyone. It was a pretty crowded room. It was a Monday. I think that was, kind of the more crowded day.
Poor guy.
And then he just grabbed the trash can and, I'm sorry. He was going, it was, of course I'm terrified because I've just started, this bright-eyed, I'm going to do chemo and kill this. And I'm like, oh boy.
Yeah.
And so one of the nurses, he comes over and he goes, hey, look what's in store for you. And I go, oh, you got to be kidding me. He's like, no, actually, we can give you things that help with the nausea that we don't want to give some of the extremely elderly people because they just, can't handle it. He said, you're young. You look pretty strong. We're going to kill you to get rid of this. And I'm like, well, okay, bring it on. He kind of hyped me up, but used a lot of humor because I was often the only one there. I was easily the youngest by a huge margin. With a lot of the other people, though, it was more of just prolonging life. And with me, it was, no, we're pushing to cure. Like, we really are going to push you. So they made that clear and would always tell me what they were doing and what that bag of whatever was and why I was getting it, and very helpful in that regard. So they're who I interacted with the most. I went into the chemo infusion center probably 20 times over the 3 months. So I saw them a lot, and they were great.
When you were telling me you go 9 to 5, I've never worked in cancer medicine. I've never had cancer, so I had no idea that infusions took that long. I had no idea that that's what a day of chemo.
Well, it just depends on what your cancer is. So in my case, there's 3 chemo drugs. There was etoposide, cisplatin, and bleomycin. But in between those, they would do things for nausea and different things like that. I'd often get those saline. I felt like there was a saline rinse after everything. There probably was much of that. And so when you got 3 of those drugs, and they're very toxic, obviously, and so on the first week of each 3-week round, I was there 9 to 5, Monday through Friday. The other 2 weeks, I'd only go in once each week for the bleomycin. It was just a weekly thing. But yeah, I was there all day. Everyone else would be gone by noon, and it would just be me sitting there by myself. So that, they usually would leave me alone because I'd sleep, or Michelle would be with me, or my parents, or someone there. But they'd often come over, and especially when they were doing a bag, often would bring humor into things, and of course joking about my age compared to everyone else around me.
Yeah. Well, and tell our listeners about, I loved what you said about the UPS man who they brought back to talk to you. Tell them that story.
Yeah. So the UPS delivery person, he'd come, pretty much every day, it seemed like. So whenever I was there and he'd come, they would always bring him back because they knew he was a testicular cancer survivor as well, and bring him back. And he would talk to me about what stage I was at and what germ cell, makeup type, because you can have seminoma, non-seminoma. There's a lot of, different types of testicular cancer. And he told me it was the tacos at Jack in the Box were his craving go-to. And for me, it was always pancakes with maple syrup. So sounded like a couple pregnant ladies with cravings back there. But they knew that he'd gone through that. And so they would invite him back just to come and talk to me. And I think it was probably helpful for him too, to just be, kind of sharing that and helping me. And I always appreciated it. And
yes, I always heard about the UPS man. Like when I come visit, he's like, oh, I got to talk to, he was a cancer survivor and everything. So that was really cool. They made that connection. And because like in the beginning, he never felt like eating really anything. And so when that UPS man started talking about the tacos, I think he was like, oh, maybe I'll try that, So I think we did try the Jack in the Box tacos.
But you know what? I did end up liking the tacos. That was one of the things I could
because it was just really hard for him to feel like eating anything. Yeah. So, but yeah, we did do a lot of pancakes too. So.
That's cool. And that's so cool. The staff there was aware, like, this is a young guy who needs to see that there's normal life after what he's going through. Yeah. So let's grab the UPS man who's totally functional now, and let's bring him back and have him connect a little bit. And I love that they used humor. I was telling you guys before that my sister had a stroke when she was young, and she said one of the most healing parts was when the healthcare providers used humor and would join her in humor in the situation. And so I love that you said, they kind of joked with you. They made you feel light. They brought a smile to your face. I love that. It sounds like that infusion center is doing a lot of things right.
Yeah.
And you said that's Dr. Tay in the St. George area,
Yes,
right?
Dr. Joseph Tay
with Revere Health.
Health in St. George.
Hey, Michelle, the next one's for you. I
Okay.
know that sometimes it's hard to navigate. Like Dan was the patient, but you were there a lot. And it's important, I think, to recognize that you're kind of treating the family unit here in some regard. And sometimes it can be hard. There are some spouses that are very overbearing. Like I'll ask Dan a question and the wife would answer every question. As a healthcare provider, that's actually one of my biggest pet peeves. Like, let Dan tell me if he has diarrhea. You don't need to tell me that. But I think it is important to turn to the spouse and say, like, how are you doing? What are your thoughts, right? To involve you in the care. So what was your experience on how you were treated by the healthcare providers and what meant a lot to you?
Yeah. So, I mean, from the very first meeting, we went together and it was just really helpful because they were really informing both of us about what it was going to look like, what was going to happen, if we had any questions. But I felt like I was really involved in that conversation as well. Obviously, I wasn't overbearing. I wasn't answering for him, but just there to learn as well. And because at home, I was really, going to be like his nurse at home. I was his caretaker at home. And there were a lot of things that I had no idea, that he shouldn't do yard work. He shouldn't be like put his hands in the dirt. I didn't know that. Not that he felt like doing yard work anyway, but it was different things that he could eat and things he couldn't eat. I didn't know he shouldn't have fresh fruit because it could have different bacteria on it. Just different things like that were very helpful for me to know. But once he actually did start his chemo treatments, I feel like it was a little tricky for me because it was during the pandemic and I had 3 young kids at home. And so I needed to be mom at home, but I also wanted to be a support for Dan. And so I really was back and forth between home and the cancer center quite a bit. We were very lucky to have good family members to come help us and support us and be able to watch our kids quite a bit during that time. But whenever I would go, they knew who I was. They had a door that they told me, like, you can come in this door, go like as often as you need, so I could come and go as I needed to, which just worked really well for me. And so I tried to be there as much as I could. I just would go in that door. I didn't have to check in with anyone. It just felt like they're very welcoming and open. Anytime I was there, there was a chair set up right next to him for me anytime I was there. And so, so I would just go hang out. Sometimes they would chat with me, see if I had any questions. But because it was the pandemic, he was only allowed to have 1 visitor at a time. And prior to that, I think a lot of people could have a lot more visitors, but with him, he could only have 1 at a time. So I was able to go, and if I wasn't there, they did let, like, his mom came to visit, or I think his brother. So we usually had people try to sit with him. So he wasn't always alone, especially because it was such long days. So so they were just so nice to just let me come and go as I needed to, and to just be there for him as much as I could.
That's awesome. So they really took time to make you feel like you could be a successful caregiver to Dan at home.
Yeah.
And did a lot of education there.
Yes.
And then they made you feel like you belonged. And you had a place right there.
Yeah. I never felt like I was in the way or an inconvenience. I think they knew how important it was that he had, the support there from his family.
Yeah. Dan, before we close, do you have any advice from your experiences on something that we as healthcare providers could do better or do differently to connect with you better?
For me, what was really helpful and important was that every different doctor along the way always would be very open at the end to what questions do you have? Tell me your questions. I want to answer your questions, because I'm sure they know that all of us go to Google and start seeing the worst possible outcomes and everything. And so we always come with the questions. And so it was really helpful that they would answer. I'm curious by nature. I love to read and research. And I would always ask the nurses, what's that bag you're putting in me this time? Oh, it's this drug is what it's called. Here's what it's for. And that way I could, look it up if I felt so inclined. And so I love that they would give me the opportunity to ask those questions. Sometimes what I wish they would have done at the end is let me know what questions I should be asking, because they'll know what kind of experiences are coming. They probably know what's on Google. If I were to search about testicular cancer, that they probably know what those 10 results are going to say and where those are going to lead me. And if they kind of anticipate, I ended up with something called Raynaud's phenomenon or Raynaud's syndrome or something, and it affects my hands always in the cold. I get these white numb spots. No one gave me any advance warning that could be coming. And so, one of my surveillance, I came and said, hey, this is what's going on. And I wish I thought to ask beforehand, hey, what are some long-term things that might be coming my way that I should be looking out for? What type of secondary cancers might come from this chemo? What kind of long-term consequences am I looking at? That if it's this, I need to call you. If it's that, don't worry about it. I wish I had known to ask that. So it would be really helpful if the doctor had said, anticipated little, oh, here's the common long-term things that are going to be a result of this. Here's what you may be on the lookout. Maybe be on the lookout for these things so that I don't have to worry about it and then ask them after I've noticed.
Yeah. Well, and I love how you said, like, maybe a question we could ask is, instead of saying, what questions do you have for me? Maybe being a little more guided, like, what questions do you have about potential side effects?
Yeah.
Or what questions do you have on what you should be looking for? Because really, you're in a spot where you've never done this before. This is all new. You don't even know what question to ask. And so I love how you're telling us that we maybe could guide patients as to the questions they should be asking. I love that.
Yeah, I think it would be helpful. Like early on, Dr. Tay specifically said, what questions do you have about your care? About what's going to, these next steps, what's going to happen and when and how. And, I had to get a PICC line in. So we went through the difference between a port and a PICC line. He answered those questions because we had never heard these terms before.
Yeah. We learned a lot.
We did not know what we were talking
Crash
about.
course.
Yeah.
And so he'd ask those kinds of questions. But I just know the last time I went in for surveillance is when I asked about the Raynaud's. And I wish early on I'd known to ask about that it was something that could happen. And I would expect they probably know that's something that kind of happens. And they said, it doesn't pose a risk. It's not curable. You don't need to worry about treatment for it. It is what it is.
It's just annoying.
It's annoying. So if knowing about, if someone says, what questions do you have? Say, what questions do you have about the long-term effect? Do you have any questions about long-term effects you might be seeing, or have you seen these types of things? Oh, actually, it's this, and you don't need to worry about it.
Yeah.
Would be kind of helpful to kind of get ahead of some of those things.
Yeah. And that's probably questions we could ask. Like on the first day when you were diagnosed with cancer, you probably didn't need all those answers. That probably would have been overload, right? Sure. And so I love that he said, at that point, that's probably when he asked, what questions do you have about your care moving forward, right? That's so he's kind of guiding you at this point in the game. This is where we're looking. And then, the next visit, maybe kind of giving another guiding question. What questions do you have about side effects that you may have from chemo and how to help? And it's kind of guiding as you do this step-by-step process throughout your treatment. So
I think those would be helpful.
Yeah.
Cool. Well, thank you guys so much. I really appreciate it. I know it can be a little tough sometimes to relive and talk about medical things in the past. And I appreciate you opening up and sharing with us. And I hope we can be a little better at our jobs because of what you've shared with us today.
Well, hopefully it helps.
Thank you so much for joining me today. If you're a patient and have a great story about a time that a healthcare provider gave you awesome care, or you're a healthcare provider who has a story about a colleague or yourself who gave incredible care, I want to hear about it. Reach out to me at Medical Manners on Instagram, or send an email to Katie, Katie, at medicalmanners.com. Together, we can transform the way we deliver healthcare by transforming the way we connect. Take care.